Indigenous people need allies, not bystanders that tolerate racism in British Columbia.
It's not a question of whether there's racism, it's a question of how far-reaching that racism is. That coming from the lead investigator now looking into prejudice against Indigenous people in BC's healthcare system. Mary Ellen Turpel-Lafond says in the past 3 weeks she's received countless emails and phone calls from people sharing their troubling personal hospital encounters.
I certainly feel a lot of pain for the suffering that I've heard over the last number of weeks, the amount to which families have suffered in silence.
The BC Health Ministry announced the independent review last month after reports staff at a Vancouver Island hospital were playing a game to guess the blood alcohol level of Indigenous patients. It appears that game in that one hospital is just the beginning.
What I'm hearing is about concerns that are in all regions of British Columbia, in all health authorities. And there are specific incidents in specific emergency rooms. Not only with the issue of playing games around intoxication.
The review will address both specific allegations and broader issues. The province is urging all Indigenous people to complete a confidential online survey about their healthcare experiences to gauge the extent of systemic racism.
It will make our healthcare system, for everyone involved, better and safer if these actions are taken.
But the investigation team also needs to hear from medical professionals.
Please engage. I will be very disappointed if when I release an initial report, I say to you, I had no engagement with physicians in British Columbia.
So far, a common theme Turpel-Lafond says she's hearing across the province is healthcare workers asking Indigenous patients if they're under the influence of alcohol, a stereotype dating back to the beginning of colonialism.
Part of the intention of that stereotyping is to dehumanize us, to take away our humanity. Because if we are not seen as fully human, then it's okay to take away our land. It's okay to strip us of our resources.
First Nations advocate Leslie Varley is confident the report will yield improved training and adequate penalties for racist behavior. But on a systemic level, she wants Indigenous-specific jobs in BC healthcare to be filled by Indigenous people.
When you put non-Indigenous people into those roles, what you're telling us is that you're not taking us very seriously at all, and anybody can do this work, when it's simply not the case. We need to see Indigenous people in leadership roles in the healthcare system. Anyone
with knowledge of racist acts in the healthcare system is asked to contact investigators in confidence by phone or email. You can visit citynews1130.com for those links. In Vancouver, Travis Prasad, City News.